All right, let's talk about dementia. Dementia is a chronic, irreversible neurodegenerative disease. Basically, you lose the ability to perform ADLs and all cognitive functions just gets worse and worse until you die. All right, just kind of a quick overview of the causes, the etiology. Alzheimer's dementia is an unknown cause, but a lot of risk factors for developing it have been identified. Vascular dementia is obviously caused by decreasing blood flow to the brain tissue, either through strokes or atherosclerosis. But some of these causes, these risk factors have been identified. Things like genetics, family history is a very strong indicator of a possible development of Alzheimer's disease. Age, the older you get, like every year after 65, your chance of developing some type of dementia, including Alzheimer's, increases. Some viral infections can lead to dementia. One of them would be like HIV, head trauma, CTE, chronic illnesses like diabetes, smoking, atherosclerosis, all of that stuff. So what goes on in your brain? There's degeneration of the cholinergic neuron and a deficiency in acetylcholine. So acetylcholine is a neurotransmitter throughout your whole nervous system. That the amount of available acetylcholine decreases because of an enzyme called acetylcholinesterase. So the ability to send signals is decreased, and then your nerves are further damaged by neuritic plaques, a buildup of protein in the nervous system called beta amyloid, the presence of something called tau, and neurofibrillary tangles. So just your nervous system inside your brain is just completely wrecked. So the stages of Alzheimer's, early stage, maybe called stage one or preclinical stage. This is the onset of symptoms, basically. The patient may present with mild memory loss, some behavioral changes, personality changes, um, misplacing common, personal belongings, maybe forgetting things they shouldn't, getting lost in a normal route, like to the grocery store, coming home. But overall, they're very much themselves. They know what's going on. They're highly functioning. They're able to perform ADLs. But there are some changes noted. And then if they go to the doctor, if they, you know, do some testing like MRI, CAT scan, cerebral spinal fluid testing, they will probably see some structural changes, chemistry changes. But the patient is still very highly functioning. This can last about 4 years. They should start focusing on getting their affairs in order once they have a diagnosis while they're still able to make decisions and have high cognitive functioning in stage one. Stage two, moderate dementia, they're going to definitely have some recognizable changes, impaired cognitive functioning, decreased short term memory is becoming very apparent, decreased ability to learn new things. They're going to not be able to handle their own finances, get lost easily. They need supervision, poor decision making skills, definitely changes in behavior, which can be very hard on the family. They might be aggressive, they might be sexually inappropriate. Um, they can have paranoia, delusions, hallucinations. Stage two, this person needs a lot of help. There are definitely some safety risks, and they can be a burden on the family. At this point, they might start thinking about institutionalizing long-term care facility, memory care facility, something like that here in stage two. Stage three is the late stage or the final stage. So stage one is typically around 4 years. Stage two, a couple of years, and stage three, they're going to live as long as somebody is supporting them and managing all of the complications, but probably not very long. So stage three is the final stage, late stage. Definitely impaired visuospatial abilities, so they're unable to recognize objects, that are commonplace objects, unable to recognize faces. They're most likely going to be bedridden or very impaired mobility. Um, and they're going to die from complications of immobility. 99% of the time, that's what gets them is these complications of immobility. And we can, keep them going, support them. They're going to need feeding, they're going to need hydration, they're going to need toileting, they're going to need basically full 24-hour complete total care at this point. Um, those are just a highlight of the stages. You can move from one stage to the other, not in the typical chronological order. You might go to stage one to stage two in a year instead of 4 years. You might exhibit signs and symptoms from all three stages at the same time. Somebody might be in late stage and still be mobile, still be able to walk. So it's not, concrete rules, but this is typical highlight, typical um, progression through the stages of dementia. All right, for medical management of Alzheimer's disease, there are a lot of medication options out there. I'm just going to go over the cholinesterase inhibitors, donepezil and rivastigmine. Those are the two that I think you should focus on. They're two pretty popular ones. The donepezil is older; it's been used for longer. But there are also like memantine and monoclonal antibodies, and a whole list of other medications used um, to treat, or therapeutics to treat the symptoms of cognitive decline in Alzheimer's. I just want to reinforce there's no cure. This isn't going to reverse the disease process, the pathophysiology. What these two medications are doing is increasing the amount of available acetylcholine, the neurotransmitter, to improve cognitive function, memory, performance of ADLs, things like that. So they're classified as cholinesterase inhibitors, donepezil, rivastigmine. They prevent the breakdown of acetylcholine. So they block the effects of acetylcholinesterase, is the enzyme that breaks down acetylcholine, and increase the amount of available acetylcholine. So the result is hopefully an increase in cognitive function. They'll typically start these medications in like the moderate and severe stages. So like stage 2, stage 3 of Alzheimer's. They can be used in combination with each other, with other drugs. The administration can be orally, or the rivastigmine can be given transdermally as a patch, which is nice because we know, the further on this disease process goes, they may have some dysphagia, inability to chew, swallow. They actually forget how to chew, swallow, eat, drink. So a patch is great, right? You want to use caution if they have liver disease, because these medications can cause hepatotoxicity, kidney disease, because the creatinine clearance of the medication might be impaired. The side effects are, commonly GI upset, like anorexia, constipation, diarrhea, nausea, vomiting, just basic stuff like that. Headaches, but adverse effects can be severe, up to and including death from seizures, bradycardias, hypotension, MI heart failure, hepatotoxicity, and the list goes on. But those are the major adverse effects and considerations. So back up to considerations or cautions. You want to be cautious if they have a bradyarrhythmia already, if they're bradycardic, or if they have low blood pressure, or if they have respiratory disease like asthma or COPD, and obviously if they have seizures, because these can be the severe adverse effects of the drug. So those are things could be considerate of if I was a nurse. And nursing management of the Alzheimer's patient. These patients are very complex, and they are going to require a lot of resources, especially as the disease progresses. The first thing you should remember is this is a family disease. The patient is obviously going to suffer from all of the changes, physical, psychological, cognitive changes, but the family is going to be highly affected as well. Most of these patients in the early and moderate stages are in the community setting. They're at home. The majority of the time, their caregivers are their family members. So people who are typically untrained, they might be older adults themselves, have their own chronic illnesses, health issues. or their children who have jobs and families of their own. So we can offer them a lot of education, support groups, community resources. Social workers are great at finding financial assistance, maybe some qualify through their insurance or Medicare for home health aides, home health nursing visits. So there's a lot we can do to try to mitigate that, but it is definitely a family disease, and they're typically in the community setting until, later stages they might be in a long-term care facility, or we definitely encounter them in the hospital setting as well. Educating your family, so knowing different education, teaching styles, and learning styles is an important thing to focus on if you're studying for this. Also, educating your patient. What's going to be specific about educating a patient with Alzheimer's? They're going to have a decreased ability to initially short-term memory loss. Eventually all memory will be impaired, but also decreased processing ability. So we're going to allow them more time to process. We're going to use multiple ways to teach, including written material, demonstration, pictures and images, repeating yourself, repeating repetitive teaching over and over, allowing them more opportunity to receive this information. And then they're probably going to need a lot of reminders. So things like pictures, stickers, post-its around the house, instructions, things like that. And involving the family in the teaching is going to be very important as well. The inpatient setting, managing these patients, especially in the moderate and later stages, is difficult because they're confused. And most geriatric patients, we already know, like 50% or higher will experience some delirium when they're in the hospital. So a dementia patient experiencing delirium is extra difficult. So safety concerns, keeping them close to the nurse's station, but not at the nurse's station to not overstimulate them with the loud environment. One-to-one sitter involving the family in their care. Hopefully somebody can stay with them. Making sure that they're safe. So things like bed alarms, fall risk, slippers, signs, wristbands. And then when they're in the inpatient setting, they can have the relocation syndrome, delirium, forgetfulness. So family can bring objects from home, pictures, different things that remind them of home or help them maybe remember where they are. It's very complex. If you do encounter somebody wandering the halls, the most important thing is safety. So we first need to address their safety. Like there might be a bunch of other options on your question on, sitters or procedures to prevent this from happening, but we need to deal with the situation that's in front of us. So speak to them calmly, calm them down, reorient them if they're able to be reoriented, or validation therapy if they're not able to be reoriented. But we need to get them back to their room first and foremost, get them somewhere safe, and then deal with the problem of them getting out of bed again. In early stages, we're going to reorient the patient if they're confused. In the moderate and late stages, it might be more appropriate for validation therapy. So if the patient's wandering the halls looking for their mother who died 30 years ago, we don't need to correct them and say, your mom's dead. We need to validate their feelings. Oh, I understand you're looking for your mom. I understand you must be worried. How can I help you? What does your mom look like? Tell me more about your mom. Things like that. Validating their feelings without lying to them. We want to be truthful, but we don't want to upset them. And really, once they get to a certain point of this disease, there's no point in reorienting them because they're not going to understand it. Reminiscence can be beneficial for this patient, so allowing them to talk about their life. And then eventually the nursing management, as the disease progresses to the end stages, all of our focus is going to be surrounded around this complications of immobility. We already know all about this, everything that can happen to you when you're immobile. It's going to basically affect all of your body systems, but we're super concerned about their GI, their nutrition, their skin, developing pneumonia, atelectasis, DVTs. All of that stuff is kind of fundamentals of nursing. Immobility complications is something you learn in the beginning of nursing. So focus on that. That's what's going to kill them in the end. Um, if something doesn't get them first before they make it to this late stage. All right. Hopefully this is helpful.